Seeing a primary care doctor is an important step in maintaining good health because they can help identify problems before they become serious. Dr. Arashdeep Litt is a board-certified internal medicine physician with Spectrum Health Medical Group, and she's here to talk with us about what you and your doctor should discuss when you go in for an appointment. So welcome, Dr. Litt.
Thanks for having me.
Yeah, well, there are a lot of things that you can do ahead of time in preparation for your appointment.
Yep.
I don't think a lot of people realize.
Yep. And we talk about it because it takes a little bit of time, on the spot. If you ask, the physician asks you questions, you might not have answers for it. So it's important to prepare for the visit. The important thing is, to have a list of questions you want to ask. Like if you're having any issues like headaches or skin things or urinary problems. So make a list of it because the visit can be, time consuming and complicated and you might forget. The second thing is make a list of all your medicines, including over-the-counter herbal medications or anything that you're taking at that point. Getting your family history, so that would require, some phone calls to some of your family members and getting the specifics, like if it's heart disease, what did they have? Did they have a stent put in? Did they have a surgery done? Did they have atrial fibrillation and a pacemaker? Because each one of them has implications on your own health, and that helps a physician to make a personalized goal for you.
You talk about your family and your genes contributing so much to your own personal health.
Yeah, so people will, patients will say heart disease, it's helpful, but not as helpful if I know, like, was it a CAD, coronary artery disease, or anything specific helps. And with cancers, we like to know what age your family member was diagnosed at. So those are some of the things to collect beforehand. And the other important thing is vaccines, the immunization. So, if you have an immunization card, bring it along. If you're younger, maybe call your mom and get that card to us, and that would be helpful at your visit. And that way we can update any vaccines that might be due at your visit.
And I think even too, you can think about the time of year. Of course, a lot of people are thinking flu shots right now and thinking about, is that a possibility? And maybe something you can do during your visit?
Yes.
Or maybe you schedule it while you're there.
It can be done at the same visit. And it might not just be the flu, you might be due for others. So if you want to get everything done in the same visit, if you bring the records, it does help me.
And the doctor is usually not the first person you see when you go to an appointment. There are other health professionals and staff that you actually talk with before, maybe that usher you into a room. And so what are the conversations you should be having with that person?
So making sure that that person, usually it's the medical assistant, they know the purpose of your visit, they know like what sorts of questions you have so that she or he can pass it on to the physician. If you brought your blood sugar readings, if you're a diabetic patient, if you brought your blood pressure readings, she can pass it along to the provider before he or she comes in to see you. So that can be reviewed beforehand. Make sure your height is checked. We talked about osteopenia porosis a few weeks back, and that is important. Any height loss signifies, there could be something going on. So make sure that your height is actually checked and not just you telling like, oh, I think I might be 5'7". The other thing we are doing at Spectrum is, we call it the fifth vital sign, paying more attention to mental health because, patients sometimes have the social stigma or they just don't want to bring it up because they feel like it's something that they can live with. So we're doing PHQ-4, which is, like a screening tool for depression, anxiety. So be prepared to bring it up on your own, but we are going to do it anyway. So just don't be surprised if you're asked some mental health questions. That's just protocol now to catch those early diagnoses and guide you towards the help that you might need.
So when the doctor arrives for the visit, what are the types of things that you should be talking about with your physician?
So all that information that you collected is going to be helpful now because the physician is going to ask those questions to you, your family history, your vaccines, if it's a physical appointment. And then also, the agenda that you had for the visit. So, if you have 4 or 5 questions and, based on the acuity of those will be addressed at that time. And at the end of the visit, your own personalized healthcare plan would be made. So like what screenings you are due for, what vaccines you are due for, is there a concern with your height, and that the PHQ-4, the depression anxiety screening tool that was done, is there a concern with that? Your diabetes, blood sugar readings, your blood pressure readings. So that is all going to kind of combine together with your own individual plan if you come prepared for that visit.
This is a great outline to follow, but we do need to stress that everybody is different. And so we go in and what might be an issue for me might be different for somebody who is maybe older or younger than me, or maybe struggles with obesity or different issues. We're all
and that's where, the importance of family history as well. exactly what age the family member was diagnosed with, let's say, colon cancer, because that is going to change what age you're going to get the colonoscopy. So that is very important. And again, you might not remember, and that's where you might have to call that family member beforehand. So more prepared. And if you're not prepared, take notes. And the next time you come in, or you can email, these days there are patient portals. So make sure all that information gets updated so that your individual plan is prepared for you.
Yeah, and there are lots of ways to get in touch with yourself, Dr. Litt. Also, the Spectrum website is a great resource with a ton of information on it of just pretty much about anything. And if people have questions or would like to schedule anything from an appointment to a physical, a flu shot, or anything else, that's a great resource. And there are so many different locations around West Michigan also, not just having to go to the main campus, but other off-sites where you can get a lot of those things done.
Yep, that is true. I think the online tool is really nice because you can set up appointments, and it is 24/7, so it's convenient. You can see which doctor you want to see, which hours they work, which location they work at. So it's as me being a mother of 2 young kids, it's really convenient not to be sitting on the phone waiting for somebody to answer the phone versus just go online and set your appointment up.
Yeah, well, thank you for the information, Dr. Litt. We appreciate it. It was very helpful.
Yep, thanks for having me.
And we have much more 8West coming up. Don't go away.
Are you West?